Epidemics and pandemics have shaped modern medicine, public policy, and still so much fear. What if the official stories that we're told about these epidemics are completely incorrect? What if the root cause of these epidemics do not lie in a virus, a microbe, or parasite? They lie in human action, in the introduction of toxicity en masse into the population. This video will explore the commonly cited epidemics and pandemics used often to refute the terrain theory and support the germ theory, but in reality we will explore that toxicity, lifestyle factors, environmental factors, not germs, are the true root causes of not only all disease, but these epidemics and pandemics as well. First, let's discuss polio. They say that polio is caused by a virus, but viruses have never been demonstrated to exist as we know them outside of the laboratory. They are laboratory artifacts, and they do not exist as self-replicating disease-causing agents in the real world. Now, polio symptoms go far back. They go much further back than the epidemic in the 70s, in much lower scales. But again, if you look at the numbers in polio, they weren't that high. This is just cited because of the fear factor. This is probably the scariest disease. You know, if you were to ever catch polio, it really is something that is, life altering. So that narrative was really important for them to get out there so that they can entrust the population with their thingies to make sure that we all take them to protect ourselves from these diseases. But reality is you cannot catch these diseases. They are not transmissible. Any controlled experiment trying to control the transmission of polio from one person to another failed miserably time and time again, and there are many references available. I do have a terrain studies list in the Beyond Terrain Academy, so make sure you go click down below. Join it. Is available to full members, and our founding member offer is expiring in 1 week. So make sure you go and join before it's too late. So before polio was diagnosed as such, it was diagnosed as infantile paralysis syndrome. Other names were used. Generally, it was just paralysis in infants and young children. These were the ones affected. Of course, this makes sense when we look at the true root causes, which actually lie in pesticides. So there are 3 main pesticides that are the cause of polio, of paralysis, and these do attack the central nervous system. There was Paris green, which was not only used as pesticides. I believe it was used in paints and different things like that. It was a dye, but it was used as pesticides. It's arsenic based. And this was really in the early 1900s. This is where you saw this as the root cause. And, we started to realize that this was toxic. So we started to introduce new pesticides. We introduced lead arsenate, lead and arsenic rather than just arsenic this time because that was unsafe in the Paris green. And, this was still early 1900s up until about World War II. And of course, World War II occurred and we moved into the use of DDT afterwards. Everyone knows the problems with DDT. Generally, people hear that term and think, oh my goodness, that's really harmful pesticide, harmed a lot of people, and it certainly did. And there's lots of evidence to show that it can also be the cause of polio. Now, there are many that claim that the cupcake itself is a cause of polio, that cases did rise during that time, and I think there's a good argument that can be made for that. But generally, to understand sort of the development of the epidemic, the persistence thereof was more likely caused by the cupcake itself. But of course, this is a classic move when it comes to epidemics as well. And you'll see this, the more you study epidemics, you'll realize that it's sort of the same playbook time and time again. And they just need to get the fear rolling before the epidemic can really take hold, right? So the fear factor is the most important, but we'll have to leave that psychological warfare aspect for another video because that could get a little deep. So I mentioned that polio was not necessarily a new disease post-World War II. This has been a long time coming. There were many cases and they were isolated cases. A small town out in the middle of upstate New York, you'd have 3 kids with infantile paralysis. It wasn't like it was widespread. It was occurring in very isolated places, where there was high use of these pesticides in the early times, like the lead arsenates and the Paris greens. And, they would dip the cattle in, and, maybe a kid would fall into these cattle dips time and time again. Perhaps not everyone was exposed at the same level, which is why you didn't see it on mass scale like some of these other kind of less severe ones, right? Because it did It is a severe disease. It is a late stage disease. You do need quite a high amount of toxicity in your system to develop some sort of paralysis to really hinder your central nervous system, such as polio. So interestingly enough, months after the first cupcake was introduced into the population, we saw cases of polio. They started to drop. They started to be lower and lower and lower. And of course, they celebrated the success of the cupcake, when in reality, they actually had banned DDT months prior. They banned the use of these toxic pesticides that were causing polio, and they actually reclassified polio. So this is another very common tactic that's used in the handbook, but they reclassified the disease. They changed the symptom profile, or the way that it's diagnosed. Pre-1954, polio was diagnosed solely based on symptoms within 24 hours. So if you were paralyzed for 24 hours and you had the symptoms of polio, the paralyzed from the waist down, etc., you would be diagnosed with polio. There was absolutely no requirement for lab confirmation, because of course laboratory confirmation can only occur by taking a spinal biopsy or a section of the spine, which cannot be done from people that are alive. This can only occur from people that have perished. So you'd have to take that and confirm it in the laboratory. But of course, it was solely based on symptoms, and it was a 24-hour window. Now, after 1955, there were much stricter diagnostic criteria set in place, by the regulatory bodies, by the CDC. Paralysis actually had to last 60 or more days to be considered polio. So we went from 24 hours to 60 days. Laboratory confirmation of the presence of the supposed virus in the spinal tissue was a often necessary component of a positive diagnosis. And of course, we had new diseases just pop up. We had transverse myelitis, aseptic myelitis, Guillain-Barré syndrome, enteroviral infections, things that affect the central nervous system. And of course, when these were diagnosed, anything less than 60 days, we would slap one of those diagnoses on, as long as we could fit into the diagnostic criteria of one of these things to see the symptoms, as long as it wasn't polio, because we wanted polio cases to go down, because of course we used the little injectables, right? So polio cases disappeared after the rollout of the cupcakes, but it was actually after the use of these extremely toxic pesticides were finally done with. We finally banned them. Now, polio is still observed around the world. Obviously, we've just renamed the condition. Now, polio is observed still in some third world countries, or places like India or Pakistan, like these areas. It's a big problem. They actually still use DDT in these areas as well. These third world countries do use DDT, and that is a big problem. What the first world gets rid of, we just ship it down to third world countries. They don't care. It's too toxic for us, but it's good enough for them, just that kind of mindset. And it still occurs in the West, the paralysis, the symptoms of the central nervous system, it still occurs. We just call it different things, when little cases crop up in a middle of nowhere, we just call it meningitis. Very scare tactic, very fear-based, is an absolutely necessary component to all of this. The resulting illusion, of course, is that we've moved the goalposts when it comes to polio diagnosis. Of course, the labeling and reporting practices changed, so the cases obviously changed as well. The paralytic symptoms and outcomes did still occur, just under new names. If you're interested in polio, you can read The Moth in the Iron Lung. Okay, let's discuss briefly influenza. This is kind of a fun one. It goes deep. Obviously, this is considered the yearly flu, but there have been times where supposedly the mutations have, created a pandemic because they were catchier. All unfounded claims, because of course we understand the nature of viruses and they have never been demonstrated to exist. And of course the gain of function is absolute psyops and nonsense perpetuated by controlled opposition. But that's a video for Justin Leslie, if you're interested in that. Prior to 1889, influenza was quite a different disease. It wasn't the yearly flu before 1889. 1889 is the year that it became the yearly flu. Every single year there were cases of influenza. Prior to that, there was no influenza. What happened in 1889? The rollout of electricity, and of course, rolled out in cities first, and that's where influenza was seen on a yearly basis. Prior to that, influenza was considered something that came into a city, wiped out half the city, and then left in a matter of, months or less than a year, right? So throughout history, sort of the different plagues or ideas of that, it would wipe out small little areas. Of course, this can be easily explained by toxicity of the entire town, of environmental toxicity exposed to an entire town or city. But after 1889, we started to see it on a yearly basis. People were going through these symptoms on a yearly basis. Now, of course, there were still pandemics like the 1918 Spanish flu, where, of course, we introduced the global radio. There were many, many electrical advancements that came from the First World War. After the war, these got rolled out into little hometowns because, of course, we had no use for our wartime goods, I suppose. So we brought them all back and started using them. So that was one little correlation there. What you'll see with influenza, and there's many more examples than you can look into, connecting electrical rollouts with a pandemic or an epidemic of influenza occurring at the exact same time. There were outbreaks around World War II as well. And of course, this was the time when radar systems came out. Many of the recent modern flus, you're looking at 1G, 2G, 3G, 4G, 5G, the good old COVID, Wi-Fi, different ideas like this, all of these electrical advancements. And of course, now the flu is so common. It occurs more than a yearly basis. Even though we all receive our cupcakes, people get sick multiple times a year. This is because we all are glued to our phones. We have our phones on us at all times. We're exposed to more electromagnetic radiation than ever. The thing about influenza is that they are non-specific symptoms, but they are very detoxification-like. They are a method of removing some sort of toxicity from the body. Of course, this does make sense even in the context of electromagnetic frequencies, because those harm the body, can damage cells, cellular processes, our systems, our internal systems. And of course, we need to remove the damage and rejuvenate the damage that has been done. And that is the process of disease. That is the process of symptoms. That is their purpose. It is to detoxify the body and rejuvenate it. Every wave of influenza correlates 100% with electrical rollout. If you want to learn more about this, The Invisible Rainbow by Arthur Furstenberg. It's a phenomenal book. Another big one, AIDS, the HIV AIDS hypothesis. Of course, very, very easily disproven that HIV is associated with AIDS. There is absolutely no evidence that they are connected. Famed scientists believe this. Lynn Margulis, she developed the endosymbiont theory. Kary Mullis, inventor of PCR. Peter Duesberg, they really fought Anthony Fauci back in the AIDS days because, yes, Anthony Fauci was the one on the front lines of the AIDS epidemic. Surprise, surprise. Now, the story of AIDS, is very different back in the day than what it is now. So we'll discuss that momentarily. But, what you see with the symptoms, it is a immune suppressant. For lack of better terms, we'll use that terminology here today. If you're interested in why the immune system doesn't actually exist as we know it, you can go and watch this video. But it is a suppressant of the immune system, right? The body's not able to detoxify and rejuvenate as it should, as needed. So it's very susceptible to other toxicities, to other things occurring. But really, it helps us understand that the toxicity that's being introduced into these groups is suppressing their immune function, right? So is a major toxicity that is occurring. I think there's evidence to say that this was a targeted attack on young gay men back in the AIDS days. That's where the initial epidemic was concentrated. And of course, the symptoms are a real phenomenon, but the disease classification and the etiology of the disease is completely incorrect. So of course, there without a doubt was a lot of drug use in that population back in the AIDS days. You can't deny that. It was a big partying era. And this was not just seen in young gay men either. It was seen in people who partied a lot. Like the Eazy-E. You go watch the NWA documentary and you're like, man, that guy did a lot of drugs. And of course he had AIDS. Of course he died from suppressed immune function. He died from poison, from toxicity, from these drugs. Generally, it's associated with the use of poppers, of amyl nitrate. And of course, this was used to kind of soften some areas of the body for, different activities. The reality is there was a lot of other drugs being used. Methamphetamines were really popular, cocaine, and preemptive antivirals. So a lot of the gay population was scared into taking antivirals preemptively, and the AZT, the drug that was used to cure AIDS and to fight it off, was given to people who were diagnosed with HIV which was just a faulty test. It wasn't correlated with symptoms at all because, of course, you can have HIV and never have symptoms of AIDS. You could just be a asymptomatic carrier, forever and ever and ever. So many people took these antiviral drugs, and these antiviral drugs were completely toxic, and they still are toxic, and they can cause suppressed immune function. And we see suppressed immune function with chemotherapy drugs, with certain injections, with so many things we understand very simply as suppressing the immune function, right? So it's not difficult to understand this connection. So of course we saw this occur in the more modern times in Africa. Africa is the population that's targeted with AIDS now. And of course, the symptoms still do occur. Watch any documentary on Africa, and you will see that the population in extreme poverty, again, likely not necessarily due to their own doings, likely due to some sort of colonial influence, but there is extremely high drug use and extremely toxic living. And often these go hand in hand. Individuals living in extremely toxic environments are coping with high drug use, and they use some synthetic drugs. They use the cheapest drugs, things they can find, synthesize, whatever they can do, whatever they can use, and they get the bottom of the barrel. They get the crap. We get the shit that we send to third world countries, so they get the stuff that we've rejected, that the first world's rejected, likely due to them directly causing symptoms. So of course there's an AIDS epidemic ongoing in Africa due to the increased amount of drug use. An important point here, of course, is that there's a huge antibody problem. Again, this feeds the whole immune system nonsense. If you are positive with HIV antibodies, you supposedly have HIV. Whereas if you are positive with influenza antibodies, supposedly you are immune to influenza. So there's sort of some nonsense there. But again, you can be positive with HIV antibodies and have HIV and never develop AIDS, right? So again, this contradicts Koch's postulates completely. Originally, the AIDS definition, it was targeted only towards the gay population. So they were reluctant to spread it out. They did eventually spread it out. Again, kind of part of that playbook where it starts with this really small population, instill a ton of fear, especially into that population, minority group. All of a sudden, boom, it spreads to the rest. And then you can blame that minority group and it creates other stigma and different things like that. There's increased hatred within the population. So there's lots of psychological aspects going on here. But of course, the definitions moved into including a whole bunch of different types of diagnosis and symptoms. As long as there was suppressed immune function, a couple of markers, those were the necessary ones to give the AIDS diagnosis. And if they know what caused the suppressed immune function, like if you get chemotherapy and you have AIDS symptoms, they're not going to diagnose you with AIDS. They're going to say, you have suppressed immune function from chemotherapy, right? So it's kind of funny that way. If they know what the toxic cause is, they're not going to give you this kind of catch-all lowered immune function diagnosis. But of course, all you need is a flawed antibody test at this point. If you're positive for HIV, they'll diagnose you, not a problem. And so in Africa, actually, it's very interesting. You can actually be diagnosed with AIDS without having a positive HIV test, and this is a resource problem. And again, touted as, some sort of medical marvel. We can diagnose people without tests. Clinical observation is the least sensitive and specific diagnostic method out there. That's why we developed tests in the first place. Now, I do think that the tests are trash. Genomic testing, serological testing, absolute garbage, absolute nonsense, holds absolutely no weight, especially outside of the laboratory. Even in the laboratory, it's problematic. But the Bangui definition, I probably butchered that name, provided a clinical case definition for AIDS in areas and populations that don't have access to the tests. So of course this included major and minor symptoms. The major symptoms included chronic fever lasting more than a month, chronic fatigue lasting more than a month, significant weight loss, usually losing more than 10% of one's body weight, asthenia, which is pronounced weakness or lack of energy. Those are the major symptoms, pretty general, non-specific. Minor symptoms, chronic cough, persistent lymphadenopathy, which is swollen lymph nodes, again, indicative of toxicity. Reoccurring herpes zoster, recurrent herpetic infections, pruritic dermatitis, oropharyngeal Candidus thrush. Additionally, Kaposi sarcoma or cryptococcal meningitis are also considered sufficient for an AIDS diagnosis. So there is a big list. Obviously here, many of these symptoms are indicative of some sort of removal, of some sort of detoxification. Cough is an excretion. Swollen lymph nodes, of course, that is the body backed up, but trying to get things out, trying to detoxify them. Any sort of skin rash, thrush, herpes zoster, herpetic infections, these are all excretions of the body as well. And of course, a chronic fever, a persisting detoxification protocol of the body to get everything out. That is one of the main ways that the body can get things out. Chronic diarrhea, again, weight loss. The body is just absolutely shedding the fat off the body, which is a store of toxicity. So you are undergoing some sort of intense detoxification. So of course, we see here that it started with a small group, as it usually does. Increase fear, increase fear. If it catches on, you move it to the general population. Increase fear, increase fear. And now it's just something that persists in the population that we all have to worry about. And hopefully one day they provide us with some sort of AIDS injection, HIV injection, so that we can be saved from this disease that can affect anyone randomly at any time, which is absolute garbage narrative. It makes no sense. It's not supported by science whatsoever. Lastly, I'll discuss briefly the COVID. This was pretty much the Spanish flu 2.0. It was kind of like AIDS 2.0. It was Fauci's second baby. Fauci was a virus hunter. Fauci thought that cancer was caused by virus. He tried to prove that. Probably one day they will prove that. I don't know why they haven't already. You can certainly see viral-like particles. They just haven't developed a faulty test yet. But essentially the idea, the reason why it's a 2.0 is just that it's a faulty test. The COVID was just a test-demic. Seemingly there was an increase in people who died during this time, likely explained by the rollout of the good old 5G. There's likely other environmental factors that have been occurring. I know glyphosate has been sprayed more than ever in the last 5 years. Chemtrails have been increasing. We're increasingly toxic, so it doesn't surprise me that there was a period in time where there were people who died. But of course, the cases themselves, 99% of people who were positive case just had a positive test. Most people were asymptomatic. Flu dropped to zero. Any sort of detoxification, cough, flu-like symptoms, all of this was just diagnosed under the umbrella of COVID. PCR tests drove the boat until we developed an antigen test, but antigen tests were not useful in a way to create a case. You were only positive if you had the PCR test, which was mostly just random. The antigen test mostly would show if someone was sick or not. But again, it's non-specific. Antigens are non-specific. So you might have had an increased antibody response, but this was not indicative of any sort of specific disease. That's supposedly what the PCR test did, but PCR is just absolutely random nonsense. Done multiple podcasts on this. You can go and browse through the YouTube videos for that. Of course, 5G launched first in China, city centers around the West. Obviously, this is where the concentration of people were who were ill, who were getting affected by this stuff. It affected the weak populations as well, just like the flu does. The people who are weak and who are full of toxicity and deficient cannot detoxify and rejuvenate properly. So of course they perish, when they are introduced to other toxicities or increased deficiency. It's just the way of the world. It's the way that disease runs. It's unfortunate, but it's part of life. It's very unfortunate. But at the same time, it's not caused by a germ or virus. That's total nonsense. I think even the excess deaths thing is sort of questionable. There's some evidence to say that it's true, some evidence to say that it's not. It sort of depends on where your reference points are and who you're talking to, what data you're looking at. But anyways, one thing really interesting about the whole COVID thing, about PCR tests, the day that the cupcakes were rolled out, Fauci came on the TV and he said, we got to crack down on laboratories. We need to lower the cycle threshold we're running the PCR test at. Cycle threshold, should be around 33 cycles. That's what I was taught in university. My molecular professor told me that if a scientific paper ran a PCR test over 33 cycles, that it was absolutely garbage. It would never be accepted in a scientific paper. But, we were running tests at 40, 45 cycles. And of course, this was in CDC documents. This was in the documents regulating the laboratories. And so as soon as the injections came out, they told the laboratories, we're going to lower the cycle thresholds to 35, 30 cycles. So there were obviously less positive tests. The higher cycle threshold, the increase there was in positive tests. That's very easy to understand as well. We changed the diagnostic criteria. We changed the laboratory test. So we see the same thing occurring time and time again with each and every one of these epidemics, pandemics, whatever you want to falsely call them. They're 100% due to toxicity, mass toxicity to the population. We can see this very clearly when you look at the maps, when you look at the outbreak maps, the methods of transmission, supposedly the perpetuation of fear, the perpetuation of the tests. It's a narrative, a faulty narrative that goes through the population. The true tools of mass psyops are the media, our problematic mindsets, the ideas that we have no agency over our health. These are what perpetuates epidemics and pandemics, as well as faulty tests. But again, that contributes to the psychological warfare, etc. The germ is the scapegoat. Viruses have never been demonstrated to exist. Pandemic, epidemics, all disease across the board is caused by toxicity, deficiencies, and traumas. If you're interested in that, I do have a free course on the true causes of disease in the Beyond Terrain Academy, so you can go and join for free. But you should truly consider joining as a founding member. There's 1 week left, onboarding call, monthly master classes, Q&As, Terrain Wellness Club with Jacob Diaz and Alex Seck, and myself, of course. Deep dives, parasites, symptoms, movement, terrain lifestyle factors, reflections, and so much more. It's really a really good bang for your buck. Go and join as a founding member. Really hope that you enjoyed this video here. Thanks for listening. Take care.